Patient Department Tutor, Aravind Eye Hospital, Madurai. Today I am here to present a topic of patient educating regarding using eye medications. Steps for educating patients on using eye medicines. After verifying the prescription with the medicines, the following steps should be followed. First, use simple, clear language to communicate. Second, explain when and how often the medicine should be taken. Third, advised on what to do in case of missed doses or an allergic reactions. 4. Demonstrate how to handle the eye drops properly. 5. Instruct on the correct way to administer the eye drops. 6. Stress the importance of a follow-up visits. First, communicate in simple language. Use the local language, especially when speaking with rural or less educated patients. Avoid using complex medical terms. Explain prescription term clearly to ensure patients understand how to take their medication. For example, clarifying prescription terms, term QID meaning 4 times a day, what to tell the patients, take these medicines 4 times daily, TAD 3 times a day, take this medicine 3 times daily, BD 2 times a day, take this medicine 2 times daily. Tip: always give clear verbal and or written instruction to avoid confusion. Second, explain when and how often to take medicines. Use simple words like morning, afternoon, evening, and night. Clearly tell how many times of your day the medicine should be taken. For example, if you say 8 times a day, explain that it means 1 dose every 2 hours. If the patient has to use more than 1 types of eye drops, explain which one to use first, how long to wait before using the next one. For example, if the patient is using antibiotic and lubricating eye drops, tell them use the antibiotic drops first. Wait at least 5 minutes before using the next drop. This helps the medicines work properly and avoid mixing. What to do in case of missed doses? Instruct the patients with the following advice. Try not to miss any doses. If a dose is missed, skip it. Do not worry. Do not take 2 doses at once to make up for the missed one. Taking too much medicines can be harmful. It's better to wait for the next schedules. What to do in case of allergic reactions? Advise the patient as follows. If the eye becomes very red, itch, swollen or painful after use the medicines, stop using it and go to the hospital immediately. Avoid using home remedies like breast milk, oil, turmeric paste and mud juice or over-the-counter eye drops without consulting a doctor. Special instructions for the following medications: steroids used to reduce swelling or inflammations. Use only as prescribed by a doctor. Don't stop early or continue too long. Follow tapering instruction. Tapering in the sense slowly reducing the dose of your medicines instead of stopping it all at once. For example, if a patient is using steroid drops 4 times a day, the doctor may advise use 4 times a day for 3 days, then 3 times a day for 3 days, then 2 times a day for 3 days, once a day for 3 days, and then stop. SOS drops. SOS means whenever necessary, this drops is using, not for a daily use. Use only when patients experiences needed pain or discomfort for using. Gel pack. Apply gently for 10 to 15 minutes and close the eye only if advised. Using eye drops with contact lenses. Lubricating drops are safe to use with contact lens. Any redness, pain or discharge, remove the lenses immediately. Do not reinsert lenses until cleared by a doctor. Using eye drops with a bandage contact lens, BCL. These lenses are designed by corneal ulcer patient. Can use eye drops, antibiotic, antifungal with the bandage contact lens BCL on. Drops will still reach the eye through the lens. Using drops and ointment together. Always use eye drops first. Wait at least 5 minutes and then apply the ointment. If the ointment is applied first, it may block the drops from entering the eye properly. Third, explain about how to handle the eye drops. Instruct the patients on proper nostril handling as follows. Do's of nostril handlings. Turn the cap to break the ring. Remove the ring and discard it. Turn it down, gently cuse it. Replace the cap, tighten the bottle. Don'ts of nostril handling. Do not touch the nozzle. Do not rinse the nozzle. Do not expose the sunlight. Do not pierce with needle. 4. Explain how to administer eye drops. Instruct the patients to follow these steps. Step 1. Tilt the head back. Step 2. Gently pull down the lower eyelid from a small pocket. This method from pouch technique. Third step. Use the prescribed number of drops into a pocket without blinking. Step 4. Close the eyes gently for about 30 seconds. Step 5. Avoid rubbing the eyes. Remember, it is important to instruct the following. Always wash hands before and after using eye drops to avoid infections. Use eye drops within 1 month of opening date. Do not share the eye drops with others, and then other eye also this drops is not using. Keep the medicines out of the reach of children to prevent accidental use. If the eye drops are expired, pour out the remaining medicine into a basin and throw the empty bottle in the dustbin. 5. Giving reminder about follow-up visits. Provide a follow-up card with a scheduled date. Advise the patients to attend all follow-up visits to monitor progress, even if the eye feels better. Instruct the patients to contact the hospital immediately if symptoms persist or worsen. Thank you.